Welcome to our webinar on transforming FP&A in multi-site healthcare organizations. My name is Brian Combs. I'm the director of our professional services group at Revelwood. I am joined by several folks who are going to get a chance to introduce themselves in a moment. But we have both Revelwood and Learn Behavioral. Our friends have joined us from there. They just recently went through an implementation, and we're really looking forward to share some of those insights with you all. What we are going to step through today, a quick who we are, not going to drain everything, just want to make sure you know who you're talking to. Quickly get into the transformation that Learn recently went through. You get an understanding of what they did. Hopefully you can see how that's applicable to maybe a situation that you all are in. We'll talk a bit about the actual implementation they did. And then Dave Miersch is going to do a demo to let you get a chance to see some of the sheets and the way we think and what we've applied at several companies throughout. So I mentioned the who we are real quick. We'll just go around and let everyone say hello. Again, my name is Brian Combs. I've been with Revelwood about a little over 7 years now. I grew up in the FP&A space, so I've still spent more time on your side of this phone than I have here. Grown up through the FP&A ranks. I've had an opportunity to lead global FP&A organizations, so really understand what you all are going through and how we can help you kind of improve your processes and such. Dave, maybe real quick on you.
Yeah, real quick, Dave Miersch. I am the Workday Adaptive Planning practice leader for Revelwood. I've been with Revelwood just going on 5 years now, but I come also, similar to Brian, I come from a FP&A background. Prior to Revelwood, I spent a lot of time in private equity healthcare, focusing generally on multi-site healthcare organizations, and have kind of brought a lot of those learnings to Revelwood and to Adaptive, and am excited to show you what we have as well as the demo coming up. And that's really about it for me.
Yeah, excellent. Brian, how about yourself?
Yeah, thanks, Ryan. Yeah, I'm the finance manager here at Learn. I've been with the team for about 3 years. Definitely have a good bit of FP&A experience at this point. Between Learn for 3 years, and then prior to that, I was working for Morgan Stanley E-Trade Financial, so working on their corporate FP&A team. So definitely appreciate the invite to this webinar, and looking forward to giving our exposure and how things went with the Revelwood team.
Yeah, absolutely. Great. No, we appreciate it. And Julia.
Thank you, Brian. Hi, everyone. My name is Julia Seelin. I'm a senior financial analyst here at Learn. I have been here throughout the implementation of Adaptive, and I've previously had around 2 years experience working in Adaptive on its own with those instances. And I'm excited to share our experience with this implementation.
Yeah, excellent. Great. Thank you. And we'll all be sharing the talking as we go through. We'll certainly bounce back and forth as we go. So let me start with a real quick. I don't want this to be only a commercial, right? But look, this is who we are. We live and breathe FP&A. We've been doing this for coming up on 30 years. You can see across the right, we've had quite a bit of success specifically in the adaptive space, winning many awards over the past few years, several hundred implementations across a wide span of industries. As you know, the system is largely industry agnostic. We do have quite a bit of FP&A experience, and more specifically to this one, some deep client-side FP&A experience, specifically with multi-site healthcare service providers. That's really the main reason Dave is here with us and helping to drive this. So you'll definitely hear more from them, more from him as we go. So just know that when you work with us, it's not going to be a lift and shift. We are going to spend ample time understanding you, any nuances about what you do, and then getting a chance to kind of implement and improve your processes. Let's hop over to Learn. Brian, why don't you tell us a bit about Learn Behavioral?
Yeah, definitely happy to. So Learn kind of at its core is a autism services company, so primarily focused on ABA therapy. That's about 80% of the business. So we have different setting environments across the US, mainly on in-center services that we operate, physical locations. We go into people's homes, so we have home-based services. And then we also work with school districts to provide that ABA therapy. So you can see a lot of our brands under the autism services side are mainly regional. Some of the biggest, between AST out on the West Coast, and then Weep in Wisconsin, and Baca in Indiana. Those are some of our bigger brands there. And then we also have the Learn Academy division. So that's about 20% of the business. Those are mainly school-based programs, some Title I, Title II, Title III tutoring services. So really a whole mix of separate brands under the Learn umbrella. So.
Yeah, that's interesting. There's a lot going on at Learn, right? Which I could only imagine prior to Adaptive trying to wrap your arms around what your numbers were, trying to gain insights, trying to do forecasts and plans. It had to have been difficult. Be curious to hear some of the challenges that you all faced prior to using Workday Adaptive Planning.
Yeah, no, definitely, long turnaround times on our budgeting process, very manual budgeting process. So, each clinic location and kind of surrounding home-based services are kind of rolled up into what we consider a cost center. And then each one of those cost centers had their own kind of Excel-based template to actually do the budgeting process. So, we're talking, 80 to 100 templates, and every year we open up, 8 to 10 centers, you get 8 more templates. You have to roll that up manually, and then roll up the roll-up file and kind of tie everything out, make sure it agrees to, the actual numbers. So a lot of manual time spent just rolling up the numbers, for sure.
Yeah, and specifically in your space with the large growth and with many others within the multi-site healthcare, just a lot of acquisitions and such. Yeah, so I've lived that world where you're in Excel and you just keep spinning up more and more Excel files and really trying to understand, oh my gosh, how do I wrap my arms around this? Yeah. So it's, I'll say, very similar to many of the challenges that we have seen across our portfolio of clients in this space. Dave, you've because of your experience, you've had an opportunity to really work with just about every one of those clients for us. Certainly what Brian just said and what's here on the screen, I would assume that resonates with you.
Yeah, it's certainly the common theme throughout. And, as we mentioned, we serve almost every subset industry within this industry, I would say, whether it's dental, behavioral services, veterinary, health systems, urgent care, the list goes on and on and on. And, the main issues that we see are going to be those. Every single location or every region is doing it differently. And there's someone who has to compile all that information together in Excel or some other disparate system. And the time to turn that around, as Brian mentioned, is extremely long and error prone for sure. So that is really kind of where Adaptive comes in for a lot of these, for almost, everyone that we speak with here is, combining all that, getting a uniform approach, and kind of just do some change management as well. That's a big part of it, and really pushing the hand. So this is how we're going to do things going forward. The system is fast, it's easy. That way, people who may be, used to Excel and are stuck in their ways, it's an easy transition for them as well. We'll show you more about that in the demo. And certainly the acquisitive nature of the industry growth, makes everything more difficult when it comes to FP&A, and that's really kind of the recurring theme.
Yeah, no, absolutely. And yeah, a couple of the items that stand out for both. It's all about that growth, and that growth not only adds some just stress because of the size. Now you have differences. Oh, I do it this way. I do it that way. So this does a couple things. You mentioned the word change management. I'm a big fan of that, and some of this just having the structure, it helps drive some of that. So I'm sure we've certainly on many of our portfolio clients, we've definitely seen improvements in that alone.
Right.
Brian, maybe I'll shift back to you, kind of thinking about some of these challenges or some of the items that you mentioned. What are a couple of the big wins that you all have seen post implementation?
Yeah, I mean, definitely a few big wins. As Dave was also alluding to, like the biggest win is just being able to keep, like a monthly rolling forecast process. Previously, when you think about our budgeting timeline, it was, a few months long. So to kind of do that on a consistent monthly basis is definitely a task that we weren't capable of before Adaptive, but we've been able to, kind of keep that going. And then the second, key win, is just in Adaptive is the data consistency, I guess would be one, and mainly in terms of scenario analysis. So if you think about being able to export, these are all the billable hours, and just go back in there, change it by 2%. What does that do to our bottom line? We don't have to open up 100 templates to do that anymore. We can do that in maybe an hour, whereas before it would take a whole day. Somebody would have to work through that type of analysis. So things like that just save us a ton of time. What if we increased our wage rates in California by 4% because we're experiencing a lot of wage pressures? What does that do in terms of our bottom line? Those are all key wins for the team.
No, yeah, certainly. And look, we all have ways to answer those today. They just take a really long time, right? And they're done in this file and that file, and maybe a little secret sauce of, well, it's always about this. Maybe I'll add that, which certainly, in my experience, has absolutely led to whether it's confusion or maybe mistrust in the data. That's a big one that certainly I have seen in the past. It's one thing to talk about the improvements on, I'll say, the doers, right? Those of us that are actually creating the forecasts and the plans and making those updates as senior leadership asks them. Have you all seen the impacts to the business, or has the leadership team said, "Oh wow, I wasn't able to get these insights in the past"? Or talk to me a bit about how that has bubbled up through the organization.
Yeah, so I mean, for the operations teams and the leadership group in general, they're able to kind of go into Adaptive and access their financial results on demand. Where previously they kind of have to, wait on us to roll everything up, send out a file, talk them through it. Very manual, not as navigation friendly. So that's been a big win for the operations team on a monthly basis. But then also just with through implementation, and we've been able to integrate our billing data, our payroll data, and financial data all into Adaptive. So just having all that data together for the operations team to see all in one place, so they're not hopping around from one system to another, not sure what is the system of truth. Those are probably the main key wins that we've been experiencing on the operations teams so far.
Yeah, those certainly sounds familiar, both from my past FP&A experiences as well as the clients that we've had a chance to work with. Now, I also tend to find that once we have a system, it allows us to really change our FP&A processes, whether it's just changing time frame or it's allowing us to iterate more and gain those insights, quicker and a bigger, better, faster. What I find myself talking about a lot. Yeah, have you seen direct impacts on specifically FP&A and how your process runs there?
Yeah, we definitely seen some impacts just on the FP&A side. We're much more focused on the analysis work, as you can imagine, with not having to always be focused on just tying out the numbers. But we've been able to start to track metrics better on our billing data, in terms of DSO by payer, kind of seeing the trended AR by payer, so we can kind of go in and identify, oh, there might be some issues with a few clients here that we need to go take a look at and reach back out to our billing team and talk to operations. Is there credentialing issues, authorizations? What's going on with this AR that we're not able to collect as quickly as we have been in the past. So those are some main areas of focus from the FP&A team that we've been able to actually work towards more recently.
Yeah, no, that's great. So much of it kind of gets us to the, well, now what? So much of our time in the past, right, is spent with just getting the data. You're out of time, right, to figure out those insights. This is a lot of words on this slide, but everyone can have a chance to consume it. These are, look, many of the items that certainly Brian just enumerated when he was talking. Hopefully, as you all are looking at these and reading them, you kind of check some mental boxes as well. Dave, similar to that prior slide, again, you've had the opportunity to work on many of these and coming from one yourself. Right. Any of these benefits in particular kind of stand out, or ones that you've seen more frequently?
Yeah, I would say for sure, just to reiterate what Brian said again, is just the time to plan reduction is huge. Even just on the fly, I always bring up an example from my past life where when I was working for a dental service organization and we were private equity owned, and we were in our board meeting with the private equity partners, and they didn't like some of the numbers, and they wanted us to, and by numbers I mean our assumptions, and they wanted us to change those assumptions and spit out a new plan within a short amount of time. Prior to Adaptive, you guys can probably imagine that's a several days, if not longer, process. When I was in that meeting, I pulled up Adaptive on the big screen in the conference room and changed some assumptions, saved those in a new version, reran a report that I had already built out with Office Connect, from Excel into PowerPoint, and had a new slide deck done within a few minutes within the room. And obviously the partners were able to see that process right there. And that's just, that's huge from a FP&A perspective, is, that credibility, as well as just the ability to do it quickly. Specifics that we see 99% of the time with our clients in this space is going to be things like volume-based modeling, capacity planning. The capacity planning is a huge aspect of it. If you think about the number of locations we're talking about on average, the number of staff to support those, it's a huge burden for the FP&A team to really forecast what that capacity is for staffing needs based on volumes for patients or services, whatever is happening. And to quickly be able to do that with an Adaptive is a much better process for our clients, that what they're used to doing, kind of ticking and tying office by office, location by location, staff by staff. And then things like the revenue recognition, automating rev rec policies for long-term care, and then certainly just the ability to slice and dice the data by, Brian mentioned their practice lines between the autism services and then the learn the school side, be able to break down the 80/20 view of the business by location, by region, by state, by provider, by payer. All those things we build into Adaptive to very quickly slice reports and views and give insights that people aren't used to seeing, because there's so much data in Excel or other systems. It's just hard to get the actual, the data is there, but getting the story from the data is always the hard part, and we make that easier for them.
Yeah, no, I love that you say the story, and look, there happens to be a book on the slide here as well. But I always felt that was my job, right? Tell the story. How do we get where we are? If it was good, how do we replicate it? If there was something negative, well, let's whittle it down to who or what drove it, change those practices, right? So we can move everything forward. Yeah, so definitely look, a lot of the items that are on this slide, certainly at the bottom, I know Dave, you'll touch on in the demo and show a handful of those. One other item just before my next question, I'll mention a lot of the concepts that we're talking about here. Look, we all know there are other tools that do this. I mentioned I've been in the FP&A space for a really long time, 30-ish years at this point myself across multiple organizations. And I've implemented global systems similar to Adaptive that say they do the same things. And I had all the same, I'll be in the board meeting and pull up a dashboard. It didn't always work that way. One of the reasons Revelwood loves Workday's adaptive planning, and I know the learned behavioral team went with that ease truly is there. You make a change live, it ripples throughout your entire system. So you make a change in a model, immediately see it in the dashboard or the report. And so a lot of these items will definitely get a chance to hopefully speak to any number of you about next steps and what to do. But just know as we step into the demo and in these kind of slides that we show, adaptive planning, it really is unique. And that's, again, just coming from experience. I've been certified in 3-4 other systems over the years, and we love adaptive for a reason. So a lot of these items, and Julie, I'm curious. I know since you were involved, really heavily involved in the implementation here, not only here but in other similar type companies. Does anything stand out, whether it's here or other, that may have been kind of unique to the needs that you all had at Learn?
So one unique thing that we like to, when we're looking at our data here at Learn, is we like to not only look at it by our GL accounts, but also expense types. So when we first came to Revelwood, the easiest approach seemed to be doing GL accounts that were cube entered. But after long discussions and under the advisement of the Revelwood team, we were able to actually incorporate the expense types into our GL account structure. So even though our accounts in Adaptive don't match that natural account code, we are able to use integration to map the GL accounts with the expense types out of our ERP system right into Adaptive, and we can view the data now exactly how we want to budget and forecast it, not just by the accounts. We don't have to do any type of slicing and dicing on the income statement. It's exactly how we want to see it. So that's been a big difference that I've seen compared to other instances.
Yeah, I can picture that. Certainly, well, I can absolutely picture because I've seen your instance. But conceptually as well. I absolutely understand that. So look, there's any number of folks that are on here across different businesses and such. All more than likely in different places in their journey as they go through here. Any particular advice you may give to an organization that's kind of in this same place that you all were, X months ago, and are now thinking about using adaptive planning for it?
Yeah, definitely. One thing would just have to be you have to be open-minded to changing your current process. For the example I just gave with our expense types, creating the GL accounts that are different from our ERP, making that change was huge for us, but also just be willing to change the current budgeting and forecasting process a little bit, because Adaptive can make things so much more efficient if you just are willing to just slight tweaks. Instead of having one sheet to do everything, assumptions are a huge game changer in Adaptive and really can speed up that process. So if you're willing to make some of those changes and go away from the norm that you may have been doing for years, you may find that you'll cut so much more time off your budgeting and forecasting.
Yeah.
Man.
I think so many of us in the FP&A space, we stick to how we're doing things right now because that's how it was done before I got here.
Oh, I always did it.
So, yeah, that's how we've always the last 10 years. The guy before me did it, the guy before me, the guy before me, so on and so forth. And it may work, but to your point, Julia, it may not be the best way or the most efficient way, right? And having a partner like Revelwood who has done dozens of these in this space specifically, but also hundreds outside of this space. We're able to bring some recommendations and best practice suggestions. I get what you're saying, team, but here's how we've done it. This many more times, and it's worked wonders and it's made people's lives easier. And so, to point, having that open mind is key.
Yeah, I couldn't echo that louder. Right, again, just the number of these that we've done. Certainly, the more willing you are to look at another way, so many benefits. Just really helping to streamline. And look, you want to be able to keep things as easy flowing as possible. Right, the more of these special one-off cases that you want. Now you're adding other items that may potentially add some maintenance, or you're having to explain to people. Our goal certainly as we go through this is keep it as simple as possible. My experience, and I know I did this, I'd fool myself into thinking, well, the more detail, the better, right? It has to be. And what that did, that more detail just took longer. And now that longer is further exacerbated by all of these sites that you all have within your companies. And now you're just multiplying, that time across as you go. So I kind of talked about some of those unique complexities, and I know Julia did as well. So certainly. I mean, hopefully you'd agree that we were able to work with you both kind of process-wise, but also within Adaptive, really to help build out some of those, enough complexity for you to drive your business, but not so much that it stalls and slows you down. Right. So hopefully we'll see all that. Look, I think why don't we hop into kind of demo time, I think. Dave, I will flip the share over to you. I will stall for a minute while you get ready.
Sure. Shouldn't be too long to stall.
Yeah, good. And look, whether we kind of chime in as we go, or I know some people are sending questions and such, so please keep all of that going as well. And I believe hopefully everyone sees Dave's screen now.
Yep. All right, awesome. Yeah, and so this demo is gonna. Sorry if I'm looking off to the side. My big screen's over there, so I apologize. But this demo replicates a space that I'm very intimately familiar with, which is the dental service organization space. It's my background prior to Revelwood, but this applies across the board, whether it's dental, eye care, urgent care, behavioral. It doesn't really matter. It's the same concepts. We just change some of the terminology, some inputs from there. So just keep that in mind as we go through this. So this first piece. This is kind of what we would consider to be a location clinic database. We only have 4 listed here, but you can imagine this list could be several hundred long. It could be 1,000 long. We have clients everywhere in between there. The easiest thing about this is it's very easy to add additional rows as the company grows. Brian mentioned earlier that they add 8 to 10 clinics or locations every year. Well, it's a very easy place to add those locations, as well as just general assumptions. And these assumptions drive other logic throughout the system in Adaptive, and it helps kind of feed other pieces. So for example, here, we'll be looking mostly at Georgia Sandy Springs for this demo, but there's acquisition date, disposition date. We might be acquiring locations, but we also might be offloading locations depending on how the business is changing and what's happening. some general assumptions for things like billing expense and admin expense rates that will feed from revenue into an expense category. And then one thing we don't do all the time, but a lot of clients have liked is having this operational hours per day. And this is a way for us to say not every location is created equal. We use the same process, but they're not really all the same. In this case here, we're looking at operating hours per day, where one location might be open, 66 hours per week, and another location might be only open 48 hours per week. Obviously, the staffing needs, the volume needs are going to be different between those two locations because they're just not serving the same number of volume of patients. Behind the scenes here, we have some triggers that kind of determine when that location is active. So you can see active clinic, which just means there's no disposition date right now. So that's driving triggers throughout Adaptive. If we change that disposition date, it's going to say, okay, as of that time, stop calculating forecasts for me because it's no longer a location I own. You'll see things like operating hours, patient volume, some other metrics that we'll talk about as well. But this is kind of like our first stop in planning within Adaptive. The next piece I'm going to focus on, again, looking at Georgia Sandy Springs here, is just standard patient volume modeling. And we can go much more deeper for specific models from here, but at a high level, what we're really looking at is we're using actuals for volume and revenue and dollars per visit, or dollars per case per visit, whatever terminology you may use, to drive the future, right? So now we're looking at what has been my trending from 12 months ago. What was my May 23 patient volume? What's my expected growth volume for this year? And give me an output there. And these assumptions can be very easily changed, where maybe I want to have a much higher patient volume growth. Maybe I want to make it 5% as opposed to 2.5%. I'll carry that across the time. I'll save that change, and my patient volume numbers will get updated in real time, as will my production, my revenues. All those pieces will then flow through as well. So now we have a higher level of volume, which you would see in your dashboarding and other capacity models. That would also reflect additional staffing needs from there. And then we have our dollars per visit, same concept, using an average trending 12 months plus a growth rate for the actual revenue, giving me a net production amount. And then we have our calculations. A lot of these calculations are more of your common size calculations. What I mean by that is, what was my medical supplies expense as a dollar per revenue last year, and use that number and apply it against my new production amount. So this gives you a high level by location, a gross margin type view, right? This is not pulling in things like personnel expensing quite yet. And speaking of personnel, we would then shift over to some staffing assumptions. So here we have a dimensional view of role. We have a potential for a lot of turnover in operations in this space. At least what I'm used to seeing, it's there's a lot of high turnover and moving between locations. So it's not often a good practice for us for these locations to plan by named person, especially when we have several hundred or thousands of employees. So we do more of a role-based model. And that role-based model is, we have our 5 different position types for this location. We have a nurse, is what we're focused on now. Hourly rates, fringe percentages, staff hours per day. And we have things like patient capacity. How many patients can one nurse serve per day? And that could be just something that the company decides. It could be location specific. It could be a regulatory compliance issue. There may be rules out there as far as you can only serve X number of patients per day. If you don't, or if you're serving more than that, you might be overburdening your staff and not serving your clients appropriately. So those are things that we would want to think about in this model. And these are all changeable by version. So Brian mentioned when they do their rolling forecasts, they might change they might have rate pressures in California. And maybe they need to change the hourly rate for the nurses and the other staff to reflect that current state of the economy and the pressures that they're feeling within the business. Those assumptions then feed into, this is more of our capacity modeling model. Again, using historical trending to feed the future. So we're feeding from a source system or some export file, the trending staff that we have per location, again, by position. Right now, we're just focusing just on the nurse position, but we have the same data for all the others. And then we look at, okay, what is that giving us in terms of staff hours per day? What is my planned office appointments? If I refresh this, can I change my staff numbers or my volume numbers on my other sheet? We did see 282 there. Now we're seeing 289 for May of 2024 patient volume. I jump back. There's that 289 right there. So the numbers flow through across Adaptive in real time. From there, we're calculating some general metrics about patients per day, patients per hour, but then also looking at that capacity target for the nurse. What is my target staff patient capacity metric? And then what am I actually planning out based off of my volume? In my current staff levels, am I meeting that capacity? And you'll see here that there is a staff capacity of 8, but based on my volume that I'm projecting for this month, I'm actually projecting to have 10 patients per staff per day. And so I have a shortfall of 2. And so that 2 then breaks down to what is that my needed FTE for that volume and what's the net change? And that's what that section down below here is showing. In reality, to serve my staff or to serve my patients, I need 2.5 nurses, which is a net gain of 0.5 FTEs. In this model, what we generally are looking at is we are meeting capacity, meaning we're going to be looking at modeling across multiple locations where if we have over or under capacity, we'll be hiring, but also moving people across locations. We're always, in this model specifically, we're always forecasting to meet capacity on demand. From there, we now have some overrides. If you do want to make changes to hours or to number of staff, you could be changing things, for specific periods. If there's more PTO planned or holidays or just maybe the office itself is closed for renovations, you can override that as well within the model here. And then from there, it's just simple math of rate times quantity. And we get that salary expense, the fringe amounts, and then that gives us our total staff expense per month down below. Again, the key thing here is all we're really changing here are some general assumptions and changing our volumes. And that's giving us all of our FTE changes and our expenses from there. So it's a low touch process that really helps people like Brian and Julia spin forecasts very quickly because they're not having to recreate the wheel every single time they need to make a change.
Here's Dave, just before you flip off that, one of the components of this that I really like is that kind of over under. We often talk about, well, let's look at both our demand as well as our supply. Now look at that delta. Now, these are those management decisions, right, that Brian was talking about earlier. Now that we have data, we can sit down with the team and understand. Dave, I think you were the one that talked about in almost all of these models that we've built, we use the staff type because that staff is fungible, right? We can move them from Sandy Springs to the next location, but only if we know we need to.
Right.
Right. And that's what this is all about. Right now, the management team can look to see, all right, do we have any issues? Can we be more profitable if I can shift people from one location to another and be able to kind of have more certainly analytics driven decision making?
Sure. Yeah, absolutely. And I think, again, using that role-based model, I am not afraid to admit mistakes from the past. And when I first used Adaptive at a multi-site healthcare, before I came to Revelwood, before I did this full time, we tried to forecast by staff name across every location. And we quickly realized that was not going to work. And I spent way too much time overburdened with allocations and movements of staff, or hey, we budgeted yesterday, but that these 10 people are no longer here. They're now these 10 people. And it was a constant reconciliation process. So doing it this way allows us to do kind of a more of a blanketed approach, but also, from, an organization standpoint, there's usually a central management organization, similar to how Brian and Julia work. They don't work at specific locations, they work for the company. People like that we would forecast at an individual named employee because they're going to be much more consistently in one position or one department location. So you have the best of both worlds. I'll call it your internal G&A planning is going to be more of a headcount named individual model. And then your operations is more of this role-based model. So you get the best of both worlds. Awesome. And so the next piece, I'm going to focus on this. This part will kind of explain some of how we can build out some revenue recognition policies. Again, this is using orthodontia. Again, this is a dental model essentially from my past life. And if you think about braces for anyone who's getting braces, you're getting those put on day one, but you have those for an extended period of time, right? And like most organizations, you have to recognize that revenue over the life of the service, not just day one. And so this model really helps us do that, where we are saying, okay, what's my gross production? How many braces did I put on this month? And how much revenue did I generate, or bookings did I generate? But also, what does that mean in terms of what actually hits revenue from a P&L perspective? Similar concept to the other model that was more just kind of, I'll say, standard general dentistry. We're looking at things like average contract rate and trending cases, again, using history to drive the forecast, with some general assumptions that we have built in for contract rate growth and case growth rates. Again, we like having overrides because while we might have good formulas and logic in here, there always may be one-offs where we might want to play with the numbers a little bit. So we always want to make sure we give options for overrides. That's that white blank row you see here. Again, simple, P times Q. In this case, we get our average contract rate times our 18 cases. That gives us a gross production of 71,473. But that's not what we recognize, right? I have braces that we put on. If I'm doing a 24-month recognition, I have to look at 24 months of history to actually give me what my revenue is for this month, plus the current production. So that's what this model does here. Again, we have this broken down by payer because we're assuming each payer type may have a different recognition policy. Blue Cross versus self-pay versus commercial Medicare, they may have different recognition policies. Maybe it's straight across flatline 24 months. In this case, for Blue Cross, we're assuming there's a much larger upfront recognition and then a smaller recognition throughout the lifespan of that 24-month case. So again, looking at the flow of data here, we have our 71,473. That's our gross production coming in from this location for this payer type. And then behind the scenes, we built in some recognition spreads. So if I do a right click and a row details here, you'll see some more data will pop up. And this is where we refer to as our revenue waterfall, essentially. And you'll see there's actually data going back to January of 2020 for this location of that recognition policy. But I'm going to jump to May of 24, just so we're looking at the same consistent time period. So we'll have May right here. Go a little bit further. There we go. I'll scroll down. So now you'll see from May of 24, I'm actually recognizing a percentage of revenue from June 2022 cases, July 22, where there was no cases, all the way up to current period. And again, this model assumes for Blue Cross, we have, I think it's actually 56% revenue recognition happens in month one. Then a much smaller revenue stream flows the remainder of the life of that brace is being put on. And so this is a way to really give us all of that detail. You can imagine looking back 24 months and pulling in that recurring revenue stream from those prior cases for 24-month period on a rolling forecast perspective would be extremely difficult to maintain. I've lived that life. That Excel waterfall model can easily break, and then you have to start from scratch all over again. This way, we have a much easier flow of data coming through. So again, looking at 24 months of history into the current period, we actually, may have had gross production of 71,000, but we are recognizing 70,000 in terms of the current month's revenue, which we'll see down below here. So this is then pulling that data back in to show what's my gross versus what's my recurring revenue recognition that I have actually flowing to the P&L. And there could be more things. Gross to net is always a common conversation we have with this practice space, where gross production, my contractual adjustments down to my net production. You could also have additional things built into the model for that as well. And there's a lot more that these models can do and are doing for our clients. If there are additional things that people want to see, then by all means, please don't hesitate to reach out to us at Revelwood. We're more than happy to show you more detailed dashboards and active planning policies that we have within adaptive planning. But hopefully this was a good, quick view to show you how simple the inputs can be, driving that additional complexity built within the model, but the low touch that the end user has is the key thing here. As a planner, my job is very easy. Adaptive does all the hard work for us. So, and with that, I'll pass the baton back over to you, Brian.
That's so, as I am pulling that back up, look, hopefully you can kind of certainly picture your specific industry or some of your processes, and really how they're done, kind of stretch or see changing what you just saw to a bit to kind of fit your mold, right? Dave, we've been able to largely use this now across any number of these, right? Any number of clients.
Yep. Yeah, we've I don't like to use the term lift and shift because it's not a pure lift and shift, but we have been able to use these concepts you just saw in those demos across several of our clients, whether it's urgent care, veterinary care, behavioral services, just large healthcare plans in general, hospital systems. Again, it's very easy for us to take this logic, make it customized for your specific need and go from there. So we use Adaptive's power plus your individual customization to really give you the best of both worlds.
Yeah, no, absolutely. Are you all seeing a logo slide?
Yep.
All right, making sure I was multiple screens here. If that's my biggest challenge of the day, we're good. As Dave said, this applies to a broad array of healthcare. This is a selection of Revelwood's clients, and you can see eye care and urgent care, human services, veterinary, dental. So again, these are, while the multi-site healthcare, it's definitely a niche. And something that Revelwood, hopefully you have seen. We have quite a bit of experience in this. It's across multiple subsectors of this. So we really hope you're able to see something today that certainly piqued your curiosity. Hopefully a list out there of, oh, I wanted to ask this, I wanted to ask that. Look, I want you to know that we're here. We're here for you. Anything you all need, certainly please reach out. We may have time for a question or two, or we're getting close to the top of the hour. But just know we're going to, again, certainly everyone that is on today, we're going to get this presentation deck in your hands. Know that everything here is a live link. So we have several success stories you can hear, certainly leading or see rather, certainly leading off with the one that the Learn Behavioral team has done with us, and each of these really lay out the problem that they saw and how they were able to solve it with Workday Adaptive. Any number of other items in here you'll be able to avail yourself of. You'll see we have a data sheet. There are a couple video vignettes and kind of video blogs and such that you can certainly take a peek at as well. And then all across the right, there's all about Revelwood and how you can reach out and get us if you need. Kind of opening it up to questions, and if any, and I was looking in on the chat thread. Does anyone have any incremental questions? I certainly have a handful, but if again, maybe just do kind of one or two, and just kind of keeping an eye on the time here. I know one that came through, and this Brian or Julia could be directed to you. I suggested earlier, look, there's any number of planning and reporting tools, right? I'm sure you all looked at more than one also. Any particular reason that stands out in your head that you chose Adaptive over those other ones?
Yeah, it's a really good question. We did look at, a few other, systems before ultimately going with Adaptive. Really the main reason we chose Adaptive is just kind of that ease of use. I wouldn't say that it's, common sense language, but definitely in a language you'll be able to, quickly pick up and understand. And, we were really looking for a tool that, we could utilize internally, even after implementation, be able to continue to expand upon, all the good work, during implementation. That I think that was the main, areas of focus for going with Adaptive over some of the other systems that are out there.
Yeah, no, those are we hear that with other clients as well. And another one in here that actually kind of touches on some of that change management that came up in part of our discussion earlier. Yeah, I know you two use it, right? Hey, FP&A has to use it. Yeah, what have you seen in the general user community of how's that adoption been?
Yeah, it's been good. I've heard some really great feedback on the navigation. We did have somewhat of a software in place before Adaptive, but definitely, the navigation and clicking through, 10 screens to just kind of find what you're looking for. We had other systems in place that the operations team used. So, just having that one source of truth where, they can go in and see their financial results, go in and see their financial dashboard. That's been really good feedback from all the users.
Right. Yeah, that's good to hear because look, that's often where we get in trouble with this type of implementation, right? We know it works for us, right? The team building, but it's to me the key of that great implementation or where the others that are involved maybe a more kind of as your team is more dispersed, be it geographically or departmentally, they say, "Oh, yeah, what's that adaptive thing? Yeah, how do I use that? Where can we go from here?" Yeah, no, so that's good. Great to hear that they've kind of taken to it and are using it. Yeah, you look, when you all get your hands on this deck, there's another 6 or 8 slides in here that everyone can certainly speak to or read and look at. Just hope you all learned something here. Again, kind of super excited to share this with you all and get a chance to work with more of you in the future. Thanks a lot, everyone.
Thanks, guys. Appreciate it.
Thanks, guys.
Thank you.